Well, there have been libraries of books written about the difference between men and women.
And one of those differences is how susceptible some women are to the flu. New this morning, John Shumway explains how researchers at Pitt are hoping to help those women. John.
Yeah, and the National Institutes of Health are putting almost $4 million into this effort. It is a study to hopefully improve prevention and treatments. Call it an unexpected side benefit of the COVID pandemic and having so many patients to study. For instance, in Japan.
And they found women between the age of about 18 to 45 had just really high hospitalization rates compared to the rest of the population, compared to men, compared to other age groups for females as well.
A result pointing to a real-world theory.
So we do believe there does exist some potential gender bias depending on the particular strain of influenza.
Dr. Jason Shoemaker and his colleagues at Pitt, along with their counterparts at the University of Wisconsin-Madison, will now try to build on a decade of studies that have looked at hormones as a reason and a possible solution.
And they've shown that these estrogens seem to change how your lung immune response should behave.
Which Dr. Shoemaker says focuses their look on studies of hormone replacement therapies.
And they found potential evidence that someone that is receiving HRT, hormone replacement therapy, is at a lower risk of severe infection from influenza than someone who is not.
So what the NIH study is setting out to do is identify the molecules and the biological pathways that are the conduits to the relief.
And in that way, we can start designing what we think would be more like sex-specific drug targets or sex-specific treatments, if you will.
And of course, that goal is to prevent or lessen the severity of flu in women.
So are they looking for volunteers at this point in the study?
I would imagine they'll get plenty when they are, but right now Dr. Shoemaker tells me they're working with animals and human cells. Human trials are expected, but right now there's no timetable for when that's going to happen.
It truly is fascinating to approach it this way.
Yeah.
Absolutely. Yeah. And if they can bring relief or prevention of the flu for women like this, man, that's a plus.
We would like it.
Yep.
For
All
sure.
right.
Thanks, John.